It is well known that COVID hit the Indigenous community hard. What's less discussed is the damage to people living in urban areas off reserve. More than half of Indigenous people live away from reserve lands in cities. In BC, that population is as high as 70%, according to the First Nations Health Authority. When the pandemic started, Indigenous adults of all ages were prioritized for vaccination. Clinics were set up in remote communities that lacked infrastructure to deal with an outbreak. And many Indigenous people, wherever they live, have underlying health conditions making them vulnerable to pandemics. But we know a majority of Indigenous people actually live in cities. And those underlying health conditions don't shed once they leave the reserve. Yet, while vaccination services traveled to remote communities, meeting people where they were, the access wasn't the same in cities. To date, there have been nearly 21,000 COVID cases amongst First Nations people in BC. More than 11,000 were people who lived off reserve, about 9,000 on. The numbers show the same thing with hospitalizations. Deaths are harder to discern because those numbers appear in a single category. While politicians across the country and in this province celebrated the early vaccination programs for remote Indigenous communities, urban Indigenous people did not benefit from the same ease of access. They were eligible, but not supported in the same ways. I keep thinking back to press conferences from those days and how an incomplete picture was being framed. I recall many self-congratulations. To politicians, I offer this: include urban Indigenous populations when you talk about supporting and serving First Nations. You might have to think twice before breaking your arm, patting yourself on the back, but at least you considered all of us. Wawmeesh Hamilton, CBC News, Vancouver.